But your 2030 vision that you have laid out, it is quite audacious. You're talking about
Very
some
audacious.
300 million people. You're currently 6.25. That is close to about 45, 46x expansion
Yeah.
from where you are now. What systemic changes does this require in how India thinks about the healthcare delivery?
One of the most important system change that needs to come in is rebalancing the system itself. The system needs to be a little bit open to the NGOs and the people who are working in this sector. And that for rebalancing, there is one ASHA worker. The ASHA worker started her journey and they came up with that for maternal and child health. But today she's expected not only to do the maternal child health and reproductive health, she has to take care of the adolescent girls, she has to take care of the babies, she has to take care of water and sanitation, she's supposed to be doing education of nutrition, she's supposed to be treating. There are about 78 different data sets and 22 different registers that she has to fill in. Where is she going to have the time? So we need to look at rebalancing the whole system. Can just one woman who is a semi-literate without enough training, will she be able to do this? No. So we will need to show the evidence how another person would be able to change the whole balance and change the equation. And the second thing I think I've been harping on that is we need to integrate technology a little bit more intelligently. Like the eSanjeevani program is not accessible to the community because we didn't take them into consideration when we built that, so that they will use it, they will own it. And the third is a lot of financing models need to evolve. They have to evolve. Rural health needs long-term investments, not just pilot funding. Every district hospital has been converted into medical colleges. Where is the money for the infrastructure development? Where are the teachers? So that needs to change. We need to build the rest of the systems before we can say that we have X number of medical colleges and this many aims that are there. We have to relook, review, and then they said that for the rural masses, there is a shortened medical education. Why? Because they are as human as you and me. Their needs are as much as you and me. So we need to be able to strengthen the system to be able to provide cutting edge education, cutting edge technologies, getting them into changing the whole system. And ultimately, any kind of system change is about shifting from a provider driven system to people driven systems. We are still provider driven system. We are still top down. Can we go and be bottom up? Get the communities to own up. And that is what will change. We need to change.